Neuroscientists talk about the hemispheres. Left hemisphere of the brain is logic and language and literal thinking. That's the higher mental functions as we get older. And the memory system here is what's called explicit memory. Because you have words, you have language, 3, 4 years old, you remember yourself in pictures, you can describe your memories. But babies and young children live in their right hemisphere. That's in the womb, in the first few years of life, is the right hemisphere. And that's about feeling. And that's implicit memory in the limbic brain. So experiences you're having as a baby are encoded in the implicit memory systems of your limbic brain. It's still going in there. It's still being programmed in. You just don't have language to describe it yet. You don't talk. You don't have words. They used to think years ago, this is really ignorant, they used to think you could do anything you want to a little baby because they're not going to remember it. Abuse them, neglect them, who cares? They're not going to remember it. Well, yes, they do, because it's programmed in. And it controls their life later on unconsciously. It's pre-verbal. So when you have early developmental trauma, here's the difficulty, the challenge for therapists. If it's in the womb in the first few years of life, even pre-verbal, and the person says now they're 15 or 20 years old, yeah, I read the records and I know a lot of bad things happened to me, but I don't remember it. It was even when I was little, a baby. So how are you supposed to help me? How are you supposed to help someone with early developmental trauma? That's pre-verbal. That's implicit. There's only one way to creep in there and do the therapy. Again, it's got to be experiential. If you create healing experiences for people, that creates access to the limbic brain, the right hemisphere, even pre-verbal trauma. Experiences get you in there.